Hey, so we love the hum in the room. It's always wonderful to hear everybody kind of socializing a bit before these events get started. And we want to welcome you all here tonight. Hope you enjoyed the yogurt. Any good? Yes? No? Okay. Susan, we want to thank you for sharing your recipe, and Alan with the group. You heard the applause. Thank you for sharing that. And so there's a class tonight. We're really lucky to have Dr. Linzmeyer come and talk to you about cardiovascular issues, and you'll have a chance to, quiz her maybe a little bit and have some fun together. But before we do that, we wanted to also share that, like, next week, I think, Scott, what is it that you're up to next week? Next week is the Magic of Fiber.
Yes.
Yeah, that's a class that I'll be giving. And then how about, is that the end of the classes?
So that's food addiction, behavior change, and then physical activity.
Food addiction, behavior change, and then physical activity. And then there's going to be kind of a gap, a hiatus of about 4 weeks or so, which usually is food demonstrations, which aren't going to happen this year. But if you wind up going through withdrawal, that you need a class, we have afternoon classes that you may choose to attend. They're at Riverbend Annex every Thursday afternoon. They're at Natural Grocers every Wednesday afternoon. And there's also going to be a class, if you'd prefer, at the Seventh-day Adventist Church every Thursday afternoon. There's 2 classes Thursday afternoon. They're all in person. They're all free. So if you get bored and you want to come and have some fun, you can attend any of those classes in the end. So with that said, I have talked way more than enough. Oh, I have one more thing to say. It really has been kind of a little frustration for me getting the medical community on board to refer patients. So we have classes that are 30, 40, 50 people. Like in Roseburg, they have 150 people that come to every 13-week class. And we're in Eugene, Springfield a lot longer. And so today, one of the things I did is went with a walk with a doc. Walked the doc along the river, begged him to send patients to these classes. And he said, well, could you do a presentation for my staff? Maybe if they understand, maybe they'll refer the patients. And so we're still working. If you go to your doctor and you have had benefit here, let your doctor know and encourage them to send people to these classes. They're really important. With that said, thank you so much for coming.
All right, everyone, just let me know if you can't hear me. The microphone is for the people who are watching online. So I can talk really loudly. So you just let me know. So on kind of along the lines of what Charlie was talking about, even in my own with my own colleagues, for a lot of them, lifestyle medicine and using food as medicine is something maybe not unheard of, but it's never really been emphasized until I came into the group. And even one administrator in the hospital was looking at me. He's like, yeah, no, I'm never doing that. And he starts walking down the hallway. And I just kind of yell after him. I'm like, be plant curious. And he's just sitting there shaking his head, and everybody else laughed. But sometimes all it takes is just igniting that spark. And so, I have a lot of my colleagues and my staff who talk to me a little bit about tweaks that they're making after hearing me speak in clinic and watching what I eat and that sort of thing. So all it takes is just igniting that spark. So I'm going to talk to you today. Can we pull up my slides? Oh, thank you. And then go ahead to the next slide. And I'm going to kind of get out of the way here. So I'm going to just talk today about a couple of the major cardiovascular risk factors, and especially focusing on nutrition, how we how important these risk factors are to the development of cardiovascular disease and what you can do from a lifestyle standpoint to try and prevent or reverse them. So next slide. So we're going to talk a little bit first about what not to eat. And I say this to all of my patients that I hate the D word, diet, because for many people, when they hear diet, it equals deprivation. All right. Diet equals deprivation. It's a 4-letter word. And yet our diets are basically our nutrition. It doesn't have to be something negative. It's just our nutrition. So I sometimes say, well, what do you eat? What's your nutrition like? And instead of using the word diet. But when it comes to making changes to our diet, it does involve decreasing the amounts of certain types of foods if we want to make a positive impact. And so for many people, that does mean depriving themselves of things that they really enjoy. But we're also going to get to what to eat more of. Because when you're eating a whole food plant-based diet, as I'm sure you've heard in previous talks, you can feel full, you can feel satisfied, you can feel that the meal was delicious and nutritious, and it doesn't necessarily end up with the result of you feeling deprived. Okay. All right. So go ahead. Next slide. So I'm going to talk a lot about cholesterol and saturated fat. So cholesterol, when it comes to the development of vascular disease or having a cardiovascular event like a stroke or a heart attack, cholesterol, especially the harmful LDL cholesterol, is like the building blocks that line your arteries. It's like the foundation of atherosclerosis. The second component to it is inflammation. You need those two things really to have a cardiovascular event. And so there are some videos just for the sake of time so we can have lots of time for questions. And I've got a little show and tell at the end. You can go to the American Heart Association Interactive Cardiovascular Library, and they have slides and they have videos on what is plaque, what does it mean when the plaque ruptures and causes a heart attack, and those sorts of things. Okay, next slide, please. So we know that when it comes to lowering our cholesterol, lower is better. In fact, we have these, they're not arbitrary numbers. They're where we really feel they're numbers that we can set a goal to. But we know that even if you get your cholesterol down in the technically normal range, if you can get it down even lower, that's even better. So lower is better. And I want to talk a little bit, just kind of off the slides, about the role of saturated fat in its impact on cholesterol in your blood when you get your labs drawn. Saturated fat is found in a lot of different foods, both animal foods and plant-based foods. Per serving, it tends to be much higher in animal-based foods. And the highest sources of saturated fat in our country tend to be cheese, chicken, and desserts like pastries, cookies, cake, that sort of thing, because of all the oils and butter that goes in there. And you might think, well, chicken's higher than meat, red meat, or bacon, or, that doesn't make any sense. But I'm talking about what we're eating. We, on average, eat way more cheese and way more chicken than we do steak, for instance. So that is why, for the sheer volume, the sheer amounts of what we're eating, those are the highest sources. And the development and metabolism of cholesterol is very, very complicated. I do not claim to completely understand it. There are cardiologists who went on to do additional training to become cholesterol specialists. They're called lipidologists. It is a very complex and somewhat nuanced field. But the reason why saturated fat is so important in our cholesterol levels, in what determines our cholesterol levels, and in fact, maybe more important than dietary cholesterol, is because it changes how our liver takes out the bad LDL cholesterol from our blood. And so studies have shown that each person in this room has a variable ability to absorb cholesterol and absorb saturated fat in the foods that we eat. Some people, and you may know some of these people, can eat a fairly heavy animal-based diet and their cholesterol's pretty fine. Maybe they are just not absorbing it because they're not genetically programmed to do that. Well, on average, most of us are absorbing at least some of it. All right. And then there are others, some of us probably in this room, as soon as you eat something with cholesterol or saturated fat, we just take it up like it's candy. Our intestines just like to soak it up and get it into our bloodstream. And so everybody is different in how much dietary cholesterol and saturated fat that they absorb. But given that we don't really have a way to tell who, other than watching what your labs do when you make dietary changes, on average, the best thing that you could do to lower your LDL cholesterol is minimize the dietary cholesterol you're eating, which only comes from animal sources, and minimize as much as possible the amount of saturated fat that you're getting, which can be found in plant-based foods like coconut oil, avocados. Those are kind of two big ones, but in certain nut butters and nuts and things like that. But per serving, much higher in animal-based foods. Okay, next slide. So the American Heart Association recommends that less than 5 to 6% of our total daily calories comes from saturated fat, and that we should, if at all possible, avoid all trans fats and trans fatty acids. Now, the partially hydrogenated oils are no longer allowed in our processed foods. However, you can get small amounts. They are not I think, is it the FDA or the whoever regulates the nutrition summary on foods allows for up to, I think, 0.5 grams without having to disclose it. So you still can get some trans fats in your foods. So these days, our trans fats, if you're still getting them, come almost entirely from animal products, mostly cows. The ruminating animals, so things like cows and the foods that cows make, cheese, meat, that sort of thing. Next, please. Okay, so let's get on to the fun part. What to eat? Go ahead. So I want to put a plug in for Dr. Michael Greger's one of his latest books. It might not be the latest. He seems to come out with books like once or twice a year. But one of his latest books is a fairly short one. I think it's 60 pages, and it's called How to Lower LDL Cholesterol Naturally with Food. Oh, she's got a copy of it right there. Super easy read, and it gives you actual concrete examples, of course, of the foods to avoid. But the actual foods, if you really want to try and get your cholesterol down, foods to eat more of that have been shown to decrease cholesterol. And I'm proud to say I recently had my cholesterol checked, and because of the regular addition of the Brazil nuts twice a week and a little bit of amla powder, which is dried Indian gooseberry, a couple of times a week, I dropped my LDL by 22 points. So I was pretty excited. That was from last year's. There are some really, really good tips in that book. So I would definitely go and buy it, and then you can have it and you can go and review it when you're forgetting things. So foods that have been proven to lower cholesterol are all part of a diet called the portfolio diet, which was studied, and it was shown to lower LDL cholesterol to the equivalent of low doses of statins. Okay. So nuts and seeds, especially the Brazil nuts, walnuts and cashews. Brazil nuts, eat in moderation because you can get selenium toxicity from it, which has some pretty nonspecific symptoms, but nausea, fatigue, those sorts of things can come from that. So 2 Brazil nuts maybe twice a week. Plant protein, especially beans and soy. Viscous fiber, which is found in barley, okra, eggplant, oats, psyllium husks, and flax. And then plant sterols. Now, to be honest, it's really difficult to get enough plant sterols to meet that goal of 2 grams per day just through plants. Most people have to do it through fortified like margarines and things like that, which seems like that's not consistent with what we normally advocate as far as avoiding most oils and processed foods, but it is, in fairness, difficult to get it through natural foods alone. Next slide. Yes, it's a spread. Was it yeah, or ben, I keep wanting to say ben, it's been not Benecol, but Benecol's one. Yeah. And I think they go by different names in the grocery store, and you might not be able to find it in all grocery stores. Okay, so this you don't have to memorize this. This is a very poor uh, copy I took with my phone camera of a page in the book. So you've probably all heard of Dr. Greger's Daily Dozen. Yeah, so this is his Daily Dozen with the addition of certain foods geared to lower cholesterol, LDL cholesterol. And if we've got a copy of the book out there, you also might take a better copy, a better photo when you look at the book. Next slide. Other beneficial nutrients for overall cardiovascular health, fiber. You're going to have a whole talk about fiber next week. So I'm going to be brief. Fiber helps sweep cholesterol through your GI tract and you eliminate it. Fiber also produces short chain fatty acids, and they are really miraculous substances that your microbiome creates to help prevent leaky gut. It helps support your immune system. It's an anti-inflammatory and may also have anti-cancer properties. Nitric oxide dilates your blood vessels. It helps heal and repair your arteries and the rest of your blood vessels. And you find this especially in dark leafy greens, celery, and beets. Anti-inflammatories like turmeric, ginger, and garlic are some of the most potent anti-inflammatories. And then antioxidants, and I'm sure most of you know what foods have high amounts of antioxidants. Berries, especially the blue or the dark purple berries, are especially high. Also like green tea, hibiscus tea, and beans, my favorite. Next. So regarding diabetes, you probably had a talk about it. Yeah. So getting back to the whole saturated fat, I don't think, first of all, we should be villainizing any macronutrient, including the category of fats. A little bit of fat that you find in nuts and seeds and avocado and things like that is not bad for you. In fact, it can be beneficial. But saturated fat really should be minimized if at all possible. And I think a lot of people over the decades have had the misconception that diabetes is caused by carbohydrates. So the carbohydrates are just villainized these days. You know, everybody's on a low carb diet. I'm eliminating all carbs and I've lost weight. So first of all, carbs are really good for you as long as they are the complex, healthy, unprocessed, unrefined carbohydrates. The root cause of diabetes is saturated fat that binds to the insulin receptors and it causes insulin resistance. Now, carbohydrates can raise your blood sugars, but if you have functional insulin receptors, your body knows what to do with that glucose in your bloodstream. It puts it in your muscle, it helps your brain, it helps your body function. That's what carbs do. They help fuel us. But if you have insulin resistance because of too much saturated fat in your diet, that is the cause of type 2 diabetes. And high blood sugars is really just the symptom. It's the clue that something is off. Next slide. This is just a quick slide on the difference between the healthy, complex, unrefined, very nutritious, low in calorie but nutrient dense carbohydrates that we should be eating more of. We know that they're very high in fiber, and we just talked about how beneficial that is. And then garbage. Okay, and so garbage are, refined, highly processed, nutrient poor, and calorie dense. And there are some examples up there. And remember, kind of going back to the words I hate, like the D word. I also don't particularly love the terms vegetarian or vegan because you can be vegan and be very unhealthy in your food choices. So those Oreos you see up there or up there, those are vegan. Okay, so not a particularly healthy choice, but you can still consider them vegan. All right. So are French fries. Oh. And what? And beer, right? Okay, next slide, please. So hypertension, I'm going to focus a little bit on, and that's going to also be the topic of our little demonstration at the end, our show and tell. So our goal blood pressure, so backing up, we came out with new blood pressure guidelines in 2025, and I actually really like them. They made things simple, all right? We all should have a goal blood pressure of less than 130 over 80. And actually normal is considered less than 120 over 80. But if we can shoot for a goal of less than 130 over 80, that will decrease our risk of cardiovascular complications. There are a couple of ways to do this through our lifestyle, our food choices, our habits. Number one is keeping our dietary sodium low. And many people say, oh, I got my blood work back and my sodium was low. So I was told by my doctor to eat more salt. That is not how it works. That is not how, that is a serum concentration. It is not reflective of how much sodium you are getting in your diet. So you want to keep your dietary sodium to, ideally even well below 2,300, but that's kind of a good goal, and that's about a teaspoon of salt per day. Eat plenty of fruits and vegetables. Those tend to be higher in potassium, which naturally lowers your blood pressure. Minimize or avoid alcohol. If you're overweight, losing weight will help bring down your blood pressure. There have been studies that showed for every 1 kilogram of weight loss, so a kilogram is 2.2 pounds, you can lower your systolic blood pressure, that's the top number, by a point. So, if you lose 10 pounds, that's plenty, that's a little less than 5-point reduction in your blood pressure. Get checked for obstructive sleep apnea, especially if you have signs or symptoms of it. Your partner or somebody listening to you sleep might observe that you snore heavily or that you actually stop breathing while you're sleeping. You might experience daytime, even though you think you slept all night, you might experience daytime fatigue or sleepiness. You're watching TV, you're falling asleep. You're in your car at a stoplight and you feel like you're going to fall asleep. That's not normal. That's not healthy. Especially if you were sleeping all night, you shouldn't be falling asleep at a stop sign or a traffic light. So you might want to get checked for sleep apnea, and getting it treated can help lower your blood pressure. And then avoid all nonsteroidal anti-inflammatories. And I can't emphasize this enough. I've had people normalize their blood pressure by stopping the ibuprofen, Motrin, Aleve, Advil, naproxen, you name it, that they take every single day for their back pain, their hip pain, their knee pain, their whatever pain that ails them. And I try and get them to normal prescription doses of acetaminophen or Tylenol. That will not raise your blood pressure. Tylenol also won't cause ulcers in your stomach, and it won't cause kidney failure. So try and avoid anti-inflammatories like those if at all possible. Next. So I just want to end with the slides anyway, with a couple of documents that came out in the last year or two. And I'm going to focus on two of these tonight. The first one is the scientific report of the 2025 Dietary Guidelines Advisory Committee. And that was submitted in December of 2024, so it came out in winter of 2025. Not to be confused with the actual dietary guidelines for Americans, the kind of final product that was supposed to take into account the advisory committee recommendations. Okay. The actual dietary guidelines for Americans was supposed to be for 2025, but it didn't actually get published until January of 26. So next slide. So a couple of things that were really emphasized for the first time with this scientific report from the Dietary Guidelines Advisory Committee is to limit total saturated fat to less than 10% of the daily calories starting at age 2 and replace with unsaturated fat, especially polyunsaturated fats. And this is obviously a direct quote. Evidence indicates that when reducing butter, processed and unprocessed red meat, and dairy, substitution or replacement with a wide range of plant-based food sources, including plant-based protein foods like beans, peas, and lentils, whole grains, vegetables, or monounsaturated fatty acid and polyunsaturated fatty acid rich vegetable oils and spreads is associated with cardiovascular disease risk reduction. This is the first time that the Dietary Advisory Committee actually recommended plant-based sources of especially protein over animal-based sources. Next slide. They also, and this is really important because I hear this all the time in clinic, they also noted that there was no evidence to support swapping animal-based products such as red meat and processed meat out for leaner meats like chicken, other poultry, in an attempt to lower their cardiovascular risk. So I hear a lot of people come in like, well, I only eat chicken and turkey and then like red meat just once in a while. We actually don't have any evidence that helps benefit us, in part because we're probably eating more chicken, which has fat, saturated fat, and it has cholesterol in it because we think we're eating something healthy. Per serving, yes, it is probably healthier, but we eat an awful lot of it, and we don't have the evidence that it actually decreases our risk. And then they suggest to replace plant sources that are high in saturated fat, such as coconut and palm oils, with vegetable oils that are higher in unsaturated fats. I'm telling you, that palm oil is sneaky, sneaky, sneaky. It is in nut butters. It is in non-dairy like margarines or spreads. It is in all sorts of foods. You really have to become, you have to remember to look at ingredient labels in the store because it gets put into so much. I mean, I know you got to bring your reading glasses to the grocery store. Yeah, right. Yes, exactly. Okay, next slide, please. Okay, so these are the actual dietary guidelines that came out earlier this year. And you can see they changed it from a pyramid to an inverted pyramid. And at the very top, there's the turkey and the cheese and the red meat. And there are vegetables at the top also. And then lower down are nuts and seeds. And you can see kind of toward the bottom, there's whole grains. And just above it, there's rice and beans. Kind of toward the bottom, and that just doesn't make a lot of sense. So let's talk a little bit about what the people who actually then published the official dietary guidelines, let's talk about what they got right. Go ahead, next slide. So they did address the impact on our health that processed foods has. Especially added sugars, refined grains, nutrient-poor and calorie-dense, highly processed foods. So they acknowledge that that's a problem. Great. I think we all can agree. They emphasized real foods. You could extrapolate that to like, oh, they mean whole foods. Okay, we all agree we should try and eat less processed food and eat more whole food. Prepared with few ingredients and without added sugars, industrial oils, artificial flavors, or preservatives. They recommend fruit and vegetables, a goal of 5 servings per day. That is the bare minimum we should be eating. Dairy without added sugars. Emphasized healthy fats and limiting saturated fat to less than 10% of daily calories, and eating whole grains while limiting refined grains. They recommended limiting alcohol, but they didn't actually give a recommended amount. It used to be that men should not have more than 2 drinks per day, women no more than 1 drink per day, but they just said limit alcohol and kind of made it that generic statement. And they recommended limiting sugars and dietary sodium. Next slide. So their protein recommendations. These are the things that they could have done better. They recommended consuming a variety of protein foods from animal sources, including eggs, poultry, seafood, and red meat. And even if somebody is a meat eater and they were following the rest of the dietary guidelines, it is going to be extraordinarily difficult keeping your daily calories recommended for saturated fat to less than 10% if you are following those guidelines of eating a variety of protein foods from animal sources. It is going to be incredibly difficult. They recommended butter and beef fat, and that is not evidence-based. And actually, that has been associated with higher LDL levels and the increased risk of cardiovascular events. And that is as opposed to using olive oil. Even though they said this was not the intention, that inverted pyramid, of course, is suggestive that plant-based sources of protein are less important or inferior to animal-based, which we also know is not true. And for centuries and centuries, vegetarians have, or if you're going to use the V words, people who ate more of a plant-focused or plant-predominant diet have thrived. So we know that that's not the case. Next slide. So this is also the first time, as far as I'm aware, and I've been out in practice for 20 years, that the American College of Cardiology came out with a specific statement addressing these 2025 dietary guidelines for Americans. And so I'm pretty proud of the fact that this was highlighted. And there are some leaders in the American College of Cardiology who do emphasize a whole food plant-based diet. So this quote goes, because plant proteins like beans, peas and lentils, and nuts and soy, as well as seafood and dairy sources, have demonstrated greater health benefits than red and processed meats, and the latter have been linked to gut dysbiosis, inflammation, diabetes mellitus, and several cancers, plant protein sources should be emphasized to patients. First time that they've ever said that as an organization. And then they go on to say, ultimately, unprocessed, fiber and nutrient-rich plant foods featured in vegetarian, whole food plant-based, Mediterranean, and DASH diets. The DASH diet is a diet that has been shown to help lower blood pressure, are optimal for cardiovascular health, cancer reduction, and longevity. So, I feel that as a society, if we're looking to our government leaders and organizations to give us appropriate dietary recommendations, I don't think that these current recommendations are entirely evidence-based. And it's really great that there are some organizations that are making a point to say that, hey, this is incorrect and it's not based on current research. Next slide. Yes, Charlie. And they were all volunteers, by the way. They were not funded by any industry. No. Yeah. I think it's because, and this is not new. This has been the way it's been for a very, very long time. It's because the guidelines are very heavily influenced by industry and by lobbying groups. Okay. They have a lot of money and they have a lot of clout. Yeah. So okay, so I'd like to end there. Before we take questions, I thought it would be interesting and maybe helpful to do a demonstration on how to correctly check your blood pressure at home. So I would say 90% of the people coming into my office have high blood pressures when they're being checked in. Are those accurate? Well, yeah, they're accurate. They probably are high, but they're in a new doctor's office. They're going to see a doctor. They haven't had their blood pressure checked in a while. They're concerned about the chest pain they're having. They're nervous. They're anxious. Okay. So it's probably accurate, but is it that way all the time? Probably not. So I tell each and every one, unless it's super high, I tell each and every one, I'm not worried about this. What is it at home? Oh, well, I don't check it at home. Okay. You need to start checking it. Because what is more important to me is not so much what I'm getting in the office, It's what they're getting routinely at home during their day-to-day activities. So on your handout, there is a little graphic that I give to many of my patients in their after visit summary on how to correctly check their blood pressure at home. Because if you're out in the yard running around after your dog, or you just finished exercising, you sit down and check it, it's going to be high. So you want to check it the same way every day. You want to be relaxed for at least 10 to 15 minutes. You want to be sitting. You ideally want to use an upper arm cuff. Most of the studies that look at blood pressure control use upper arm cuffs. The wrist cuffs, they might be accurate, but if they're more likely to be inaccurate, and especially if you're not using it correctly. And then finally, if you do check your blood pressure at home, I would pick the same time of day, morning or night. Blood pressures on average tend to be higher in the morning than they are in the evening because our cortisol levels are higher. So pick the same day, same time of day. If it is a little high, wait a few minutes and check it again. All right. The other thing is that if you do have a blood pressure cuff at home, bring it into your doctor's office. Okay. It's not that your doctor's office, their cuff is absolutely correct and yours isn't. What I want to make sure is that they're pretty similar. If your cuff at home is reading 40 points higher or 40 points lower than a healthcare provider's cuff, one of them's wrong. Okay. But if they're within 10 points of each other, fine. They're perfect. Keep using your cuff at home. So, is there a volunteer in the audience who'd like to come and get their blood pressure checked? Yep. All right. Right here. So, well, there's a little bit of risk involved here, right? Good. You sit right there, and we're going to use your right arm, and you're going to, yep, just that. Okay. I'm going to get out my handy dandy cuff. Now, a lot of people tell me or ask me, well, what kind of cuff should I get? And I tell them, don't buy the most expensive cuff and don't buy the cheapest cuff. Okay. Get one that's middle of the road, ideally an upper arm cuff, and get a digital cuff like this. It also, some of the newer models can give you your heart rate, and it can also provide a not perfect, but a clue to atrial fibrillation detection if it notices that your heart rate's irregular, and that would just be a clue to get it checked out. Atrial fibrillation is an abnormal heart rhythm. This is an Omron cuff, OMRON. This is one that we recommend to a lot of our patients. It's pretty reliable. I do not own stock in the company, but this is just the one that we tend to recommend. And again, this is a middle of the road cuff. I did not get the one that syncs to your phone. So I'm not that fancy. Okay. All right. So she's been sitting for this entire presentation, and then she just moved up here. So I think that's been resting. She's got her legs uncrossed. She's got her arm resting on a table, an armrest, something like that, where the upper arm, where we're going to put the cuff, is at about the level of her heart. So this is where the wrist cuffs can sometimes be problematic. If you are going to use a wrist cuff and you have calibrated it with your primary care provider or some provider's office, so you know it's pretty accurate, you lean back in the chair just like she is, and you just put your wrist over your heart. So again, the cuff is at the level of your heart. All right, so I'm going to set this down. The other thing is that when you're purchasing a cuff, you do want to get the right sized cuff. Okay. If it is too small, your blood pressure is going to read falsely high. If it is too big for your arm, it's going to read falsely low. And it'll give you the size. Here it says the arm should be between 22 and 42 centimeters or 9 to 17 inches. So if you've got a big arm, you might need a different size cuff. Go ahead. Sure. Think peaceful, pleasant thoughts.
What about the hand over the heart?
That's only if it's a wrist cuff.
Oh.
Yeah. The upper arm cuff, what she's doing right here is perfect. On most of the cuffs, they'll have an arrow, or it's wherever the actual pressure is being inserted into the cuff to blow it up. That needs to go kind of right over your biceps tendon here, okay? So that's where your heart is. So that's how I arranged it.
What did you say that the word for the one that it's bigger than that? It's for, I'm not gonna try to say it. It's black, you have it. I'm asking, what does it do that one doesn't?
I guess I don't understand. I have this thing.
So that is why, never
Yeah,
mind.
yes, yeah, this is it. This is just the one. Okay, so we're just gonna relax. We're gonna take it one more time. And yeah, uncross your legs. Make sure this is yeah. Well, I'm making me nervous.
I heard if you're gonna take your blood pressure twice, you have to wait. Is that how long you wait? How long you wait between the first time you take it, the second time?
2 minutes. Across the, oh, it's also. Okay, hang on.
Yeah.
Gotta use that device.
No, but.
There we go. How's that? Yeah, we need this though. This needs to the front, so I'll let you actually, so it doesn't pinch, and then I'll. Oh, that kind of is. There, how's that? Better? All right, go ahead and relax your arm. Yeah, go ahead. All right, let's try this again. Okay. And I have calibrated this cup.
Yeah. No.
What were the symptoms of really high blood pressure?
Well, so high blood pressure is called the silent killer. Most people don't have symptoms. Okay, no, it's silent. It is a silent disease, a silent risk factor, until you have a heart attack, or you have a stroke, or you have an abnormal heart rhythm. So what I'm saying is that you can have high blood pressure for years and years and not know it. And that's why it's important to check it every once in a while. So still just a little high. We can check. Yes.
Is there any point when a lower blood pressure is a concern?
Especially if you're symptomatic. So let's go back to answering your question. You can develop symptoms that are clearly related to high blood pressure. You can develop angina, chest pain. You can develop shortness of breath because your heart is a muscle. It's one of the strongest muscles in your body. And oh, sorry. Thank you. So your heart is one of the strongest muscles in your body. So if you go to the gym and you're lifting weights, you're lifting heavy weights because you want to get nice, strong muscles. At some point, you need to put the weights down and let your muscles rest and recover. Same thing with your heart. When you're exercising, when you're stressed or you're nervous or you're running around, your blood pressure is going to be appropriately higher. Okay, that's kind of like a workout for your heart. But then when you're resting, you're just hanging out and you're eating dinner or you're watching a movie or you're reading a book, it should be nice and low. Okay, that's the time for your heart to be able to relax and recover. So if your heart is pumping against a really high weight all the time, at some point it is going to get worn out and it's going to start to complain. You might get chest pain, you might get congestive heart failure, shortness of breath. Some people can get neurologic symptoms like mini strokes or stroke-like symptoms or just bad headaches. Some people just feel lousy. Like, what is wrong with me? I'm just exhausted. I'm just so run down, and they check their blood pressure and it's 200 over 110, without any obvious other symptoms. So that's why it's important to check it once in a while, because for most people, when they're starting to develop high blood pressure, it's not necessarily that high. It's 140 over 92. It's 145 over 87. We want to catch it when it's mild So we can start working on ways to bring it down with, ideally without medications, but for some people, they do require medications. Low blood pressure also is it's a little variable. With high blood pressure, we know we all should be keeping it down under 130/80. There's only a couple of exceptions that I have said to somebody, I think we need to let your blood pressure get a little higher. But for low blood pressure, a blood pressure of 90/55 in many of us can be totally normal and we feel great. Okay, and especially younger people, that's blood pressure in the 90s systolic is very normal. But if you're somebody who's had high blood pressure for years and is 80 years old, and maybe is on 1 or 2 or 3 blood pressure medicines and their blood pressure is dropping into the 90s, they will not feel well. They often will get lightheaded, feel like they're going to faint, or maybe actually faint, feel very weak, like their legs are made out of jelly and buckle underneath them. So for low blood pressure, we technically say that top number systolic of under 90 is too low. There are some people who, especially if they have certain types of heart disease, we allow them to have that low blood pressure because of trying to get their hearts stronger using various medications. This is specifically in like congestive heart failure patients. So. I was also going to mention real quick before I take your question. Thank you. In the hypertension guidelines, they really emphasized for the first time that goal blood pressure of less than 130/80 actually can decrease the risk of cognitive decline, like dementia. And so there's more and more evidence that dementia, including Alzheimer's dementia, is a vascular disease, not just from strokes. A stroke-related dementia is a different type of dementia. But the Alzheimer's dementia is very much a vascular disease. It's a disease of inflammation. And one of the ways to help decrease your risk of dementia is keeping that blood pressure controlled. So, when I mention that to people, if they're not too concerned about their blood pressure being 140/90, and they're like, oh, it's, I feel great. What's the big deal? When I mention the risk of dementia, that tends to make their ears kind of perk up, like, oh, okay. So there was somebody here.
Yeah, regarding medications.
Yeah.
If you're diabetic, it seems like they always want you cholesterol and blood pressure medication, even if it's not even.
So I feel like that is changing a little bit, maybe not fast enough, for people who have very well controlled type 2 diabetes, who are working on reversing their diabetes and improving their A1C, and their blood pressure is normal and their cholesterol is where it needs to be, then we're having more of a discussion about it. Or at least that's what should be happening, instead of just, okay, you've got the diagnosis of diabetes, you need to be on this, this, and this. There is no doubt that because people who have type 2 diabetes are at increased risk for cardiovascular disease, that we want to get on those additional risk factors and get their cholesterol low and their blood pressure normal and really be aggressive with them. However, one example is that we used to put everybody with type 2 diabetes on aspirin. You got that diagnosis, you need to be on an aspirin. And that is starting to, that approach is becoming more nuanced. Not everybody who has type 2 diabetes needs to be on an aspirin. So I think it really warrants a discussion with primary care provider about, what if I keep working on making some of these changes and let's see where things go.
Would the VA be different than like other healthcare providers?
The VA. There are some excellent providers at the VA. The VA, though, also is a very structured, bureaucratic institution, and they have kind of these checklists that they like to,
Those you get this.
Yes, exactly. And so I still think that you can have a discussion, though, and
It's
just
like there's like a lack of trust that you're actually doing what you're.
Yeah. Right. Well, and also in fairness to the providers, you know, with certain diagnoses, because the risk is elevated, they're just trying to help protect their patients. The problem lies in that there's not enough discussion about lifestyle changes. There's too much discussion about just medications. That's what the problem is, whether you're at the VA or some other, you know, clinic. So, somebody else.
Heart murmurs, can you talk a little bit about heart murmurs?
Heart murmur is just a sign, a physical exam sign. You can have a totally normal heart, normal valves, and have a flow murmur, which is benign. It's normal. So heart murmurs, though, sometimes can indicate valve problems. It sometimes can indicate holes or defects, like congenital defects in the heart. So an easy way to get it checked out is through an echo. It's just an ultrasound of the heart. And if the valves all check out, they look great, it's probably just a flow murmur. Yeah, a heart murmur is not a diagnosis, it's a physical exam finding. And so it's what does that heart murmur reflect? If it reflects that, you know, nothing, then it's just a flow murmur. So, right.
So you mentioned more fruit and vegetables, and
Mhm.
you've got that chart on there.
Mhm.
For lowering blood pressure, could you comment about a category that not a lot of people miss? Dark green leafy vegetables and the nitric oxide and that issue.
Yeah, so I did touch on that briefly, it's the dark leafy greens, it's beets, celery. Those are the foods that tend to be really high in nitric oxide. And actually, I listened to a podcast, and I can't remember if it was on the exam room or not. They talked about how much the precursor to nitric oxide is found in celery. And so we have to eat a lot of celery. So the dark leafy greens can increase your body's production of nitric oxide, which, like I said, dilates your vessels and can help heal your vessels. And one way to help potentiate the benefits of those dark leafy greens is to put a little balsamic vinegar on it. And I can't remember. Do you remember why? It's something to do with helps absorption.
Absorption.
Yeah, helps absorption. Yeah, right. So,
But I have a question.
Oh.
So, in the recommended guidelines, they talked about eliminating waste of NSAIDs. But types of chronic cardiovascular conditions warrant use of the use.
so the easy answer is if you've already had a cardiovascular event like heart attack or needed a stent.
I had an ablation.
So it depends on what no, not usually. But again, when it comes to specific individual recommendations, I'm a little hesitant without knowing, yeah. But daily aspirin absolutely for secondary prevention after a heart attack or needing a stent or open heart surgery for bypass surgery. And then for people who are at really high risk, they have multiple risk factors for heart disease. Maybe they have a really elevated calcium score, which indicates they have a lot of plaque in their arteries. There are some people that we start recommending low dose aspirin for primary prevention. But with aspirin, we're starting to back away of just giving it out like candy because of the risks of bleeding, especially some bleeding GI bleeding. Yeah.
I had a calcium score of 0. So
There you go. Yeah. A caveat with calcium scores, though, is that only picks up calcified plaque. It does not pick up soft, vulnerable, non-calcified plaque. That is the plaque that's more inflamed and more likely to rupture. So a calcium score is just a hint. It's one more clue. It does not paint the full picture. Yes.
You mentioned that congestive heart failure times, is that reversible?
It,
Or is that a lifelong diagnosis?
when people have congestive heart failure, it depends on the cause. Almost always, it is going to require some form of medication, procedure, something like that to help improve symptoms and improve the heart function. Whether you need to stay on all of those while you're making lifestyle changes, that depends on what the cause was. Sometimes you do, but sometimes you can start weaning down or weaning off some of the medications. And especially when it comes to congestive heart failure, well, actually many forms of cardiovascular disease, the medications we use can be lumped into two basic categories: One are the medications that make you feel better. They don't necessarily make you live any longer. They make you feel better, which is important. And then there's the other category of medications that don't necessarily change how you feel immediately, but they help you live longer. They help your heart improve its function, which then later on down the road can help you feel better also. But
Of all the foods that we've talked about tonight, what would you say is the most important food group to really emphasize when you have heart disease?
to eat or to avoid?
Why don't, yeah, mainly to eat, see, if you're really trying to really improve the condition of your heart.
Mhm.
We have all these wonderful foods to eat, but what do you feel is the most important? What would be lacking in somebody's diet?
Fiber. Anything with fiber, we need to get more fiber in our diets. And the foods to avoid, if I had to pick one big category, would be processed or ultra processed foods. And the reason is that that tends to be loaded with sugar, salt, and fat. Okay, but I mean, everybody's got their challenges. So for one person, it might be they really need to cut down on sodium. And another person might be you really need to cut down on saturated fat. So, or both. So, yes. Yeah.
Quick question that I have, my mother-in-law has been diagnosed with SBT,
Uh-huh.
super ventricular tachycardia.
Yeah.
But she loves eggs. She just, that is her steady diet, it's eggs,
Uh-huh.
but she throws vegetables in it.
Yeah.
But it is, she also has now been diagnosed with Parkinson's. So anyway, we're trying to monitor food, diet, pills, all that stuff. I just wondered about eggs. It seems like there's been a lot of back and forth.
Right. So eggs are low in saturated fat, very little saturated fat in eggs. So that's a plus. They do tend to have a bit of cholesterol. It's not the highest cholesterol containing food. And if you remove the yolks, then you're really removing most of the cholesterol. But people eat eggs. Some people eat eggs every single day. So, I mean, I feel like we need to meet people where they are. If is mother or mother-in-law
Mother-in-law.
is otherwise making a lot of healthy choices and choosing some healthy choices, more fruits and vegetables, more plant-based sources of protein otherwise, and she eats eggs once or twice a week, I wouldn't give her, I wouldn't give her a hard time about it. But if she's eating eggs a couple times a day and her cholesterol's climbing, well, maybe she needs to cut down on that. Yeah. So I really feel like we shouldn't be too judgmental of ourselves. Yeah, and try and help people just make healthier choices. Yeah. Yes. You're bulk buying the eggs. Yes, right. Yes. I didn't actually say what it was, so that's a good question. It causes your kidneys to hold on to sodium, which then raises your blood pressure because your kidneys are one. Oh, sure. The question was, why are NSAIDs, those anti-inflammatory medications, how do they cause high blood pressure? And so it's related to its effects on the kidneys, and the kidneys hold on to sodium and water when you're taking NSAIDs on a regular basis, and that raises your blood pressure. It raises the volume in your blood. So your blood vessels are just like they're like pipes. So the more volume you have in it, the more pressure.
Solid is normal. Is it still other? It's not so good cardiovascular wise to take it.
It's mostly related to blood pressure. There may be some other direct effects on it. But the bigger issue is that if people are taking NSAIDs on a regular basis, it can cause kidney failure and it can cause ulcers. Yeah. Yeah. So again, it depends on what that's like a very individual specific, it depends on where the pain is. Sometimes you can use lidocaine patches to help with bursitis type pain, or back pain or things like that. And I also think that with antacid therapy if necessary, with taking NSAIDs with food and just keeping the dose, the minimum amount. There are some people who have to take them to have quality of life. So again, it's a very individual discussion you have with your provider. Remember, these are kind of blanket recommendations. I have patients who are on NSAIDs because they can't survive without them. Okay. And I don't want them to be miserable. They want to be able to tie their shoes in the morning, you know. So, Charlie.
So I just need to make a comment about the Brazil nut issue.
Yeah, yeah.
I've been eating one Brazil nut a week.
Mhm.
And I got rocked on my heels by a person I talked to on the phone, or one of the class members, who said it's 4 Brazil nuts at the same time once a month.
Oh.
And I said, I don't remember seeing any of that. And so I did a search on
Yeah.
nutritionfacts.org, right
Yeah.
outside. And he says the study that was showing the lower cholesterol is 4 Brazil nuts the same time once a month. And that if you take Brazil nuts like one a day, it can increase your inflammation.
Yeah. Inflammation.
Inflammation. And
Yeah.
so I've since changed, and it only came about a couple weeks ago. And since we have so many.
What does he say in his book?
Huh?
Does he take 4?
I don't remember seeing that, but this is on his new program, the artificial intelligence. He makes himself a bot. I don't know if you have seen that.
Gregor bot.
It's the Gregor bot, and you can ask it any question you want.
I played the
And
Yeah.
and it says 4 Brazils on the same time.
Yeah. All right. Well, I'm going to keep doing what I'm doing because I lowered my LDL by 22 points. So, yes. Yeah. No. No. There are people who are genetically programmed to have an extremely low LDL cholesterol. I can't remember. Was it in Africa? Where was it?
Yes, that's what today.
And like their LDL cholesterols are 10. LDL. Well, but that's going to reflect in the total. Their total is probably 50 or 60 or something. Sorry, your total?
Yeah.
Okay, yeah, no, that's fine. Yeah. So no, there's no, when you think about babies have incredibly low LDL cholesterols. It only climbs later on based on what they're eating for the most part. So, but there are people who genetically have extraordinarily low LDL cholesterol because they, you've maybe heard of the class of medications called PCSK9 inhibitors. They lack that enzyme that breaks down the LDL receptor to remove it from the blood. And so they remove all their LDL from the bloodstream and they get rid of it, and their LDL is super low and they have no heart disease. So when people say to me, well, I need some cholesterol for my brain health. Yes, you'll get plenty. Your body will produce what it needs. Yep. Yes.
Heart flutters and concerns with it.
Flutters? That's just a symptom. It's there. Other people might call them palpitations, and it just depends on what's causing them. So you tend to wear a heart monitor, or you get an EKGs to help pick up what those flutters are from. Sometimes they're just normal. You're in a normal rhythm, but sometimes it can mean you have some extra beats or you actually have an arrhythmia. So it's more just a symptom. Somebody might come into my office and say, I'm feeling like I get these flutterings in my chest or I get palpitations. And then we start talking about how to investigate that further. So.
You explained triglycerides, and I always understood that was worse than the cholesterol, that getting the triglycerides under control. But I don't really understand what it is.
It's important to get the triglycerides down under 150, which is our goal. However, unless you have a hereditary high triglyceride, like where it's often over 1,000, and in fact, the biggest risk there is not heart disease, it's pancreatitis. Yes, like bad pancreatitis, like you don't want to get that. And so that's often a hereditary issue. And so, yes, we definitely need to get the triglycerides down, but more to prevent that complication rather than heart disease, although we want to prevent heart disease also. No, LDL cholesterol is, when it comes to cardiovascular disease, is the most important. And again, and your triglycerides for people who just have bread and butter variety high triglycerides where they're, between 150 and 500. I talk to them about diet. That's the way to get it down. And we can totally normalize the triglyceride. Triglycerides are very, very dependent on what you're eating. The exception is people who have the hereditary form of it. And their triglycerides, like I said, are in thousands sometimes. Yeah.
Last good where I looked at cholesterol numbers and the triglycerides significantly. I haven't had checked it on my own, probably a little later in the fall, but I was really impressed by totally changing my diet, how I could work on reversing heart disease and risk factors.
Yeah,
And
good.
I'm very impressed.
Good.
And the high fiber
Mhm.
was a game changer for me.
Mhm.
But realized how deficient I was, and so I really was focusing on what I was eating every day.
Right.
I thought I ate healthily, but I was really off the mark.
Yeah.
And missing fiber.
Mhm.
The amount of fiber I think now is
Yeah.
substantial. So-
And a nice kind of tip is that when you're looking for high fiber foods in a plant-based diet, protein is usually going to follow and vice versa. So that's why beans are one of my favorite foods because they're going to be very high in fiber and they're high in protein. So when you're looking for those high fiber foods, often they'll be higher in protein and vice versa. So,
Well, I think I understand and I know that I'm supposed to be lowering my LDL. What is VLDL? I've got a report that just told me that something about VLDL, that I have it. And I
Yeah,
just
it's
wondering what it is.
very low. To be honest, I hate to say this, but I wouldn't worry about it. I would focus on making sure this is not the discussion for lipoprotein little a. You may have all heard of lipoprotein little a. I would make sure that you check your lipoprotein little a. You only need to check it once in your life and make sure it's normal. And if it's not, talk to your provider about what you need to do. That's a genetic cholesterol particle. And then check your regular lipid panel that has the LDL, the non-HDL, the total, the triglycerides, those sorts of things. And in some people who tend to run a higher triglyceride level, your doctor might check something called an ApoB lipoprotein. And that is, especially with high triglycerides, it is a better marker for your overall cholesterol number that causes atherosclerosis. Because not to get too much in the weeds, but if your triglycerides are high, it's harder to calculate an accurate LDL. Because most of the time it's calculated. It's not measured directly. So yes.
You mentioned earlier not wanting to use diet to raise your sodium levels. To not get the sodium from your diet.
Yeah.
There
are a couple of exceptions to that, but rare. But go ahead.
What are your recommendations for someone with POTS?
POTS. So positional orthostatic tachycardia syndrome. It's a real hot button topic and often misdiagnosed. So when people have POTS, they tend to have a low blood pressure when they stand up, quite symptomatic, and their heart is racing. And often their heart continues to race even after they sit down. And this was very, very common and has been common, especially after COVID with the long COVID. People who developed long COVID, POTS was one of the problems that developed. It's a nervous system problem, actually. It's not a cardiovascular problem. It's the nervous system that is driving the heart rate and the blood pressure, the blood pressure constriction and dilation. And so with people who are struggling with these really low blood pressures, we do recommend that they are a little more lenient with their sodium intake so they can fill the tank. I was saying your blood vessels are like pipes. They're like a tank. You want to fill the tank. And so a little extra sodium, even electrolyte drinks or electrolyte tablets are sometimes beneficial. And I'd much rather have people hydrate, electrolyte drinks, electrolyte tablets, liberalize their sodium intake a little bit while they're treating their POTS symptoms. There's other things to do for POTS also that we won't get into, but as far as sodium, that can be very, very helpful. So there are some people and certain types of disorders that a higher sodium diet actually is helpful. Yes.
hypothyroid is on hyperthyroid affect blood pressure.
So the question is, do thyroid disorders affect the blood pressure? They can, especially if somebody is going into like hypothyroid coma, induced coma. I mean, blood pressure can be quite low. They're often oozing fluid. They're very swollen and edematous. Hyperthyroidism, I suppose their blood pressure might be a little high. You more often notice weight loss, sweating, palpitations, or the flutterings. But blood pressure doesn't tend to be as much of an issue. They tend to have a lot of other symptoms. It might be a little high, but it doesn't tend to go up through the roof. Not that I've seen anyway. It's usually the other symptoms that's how we find the diagnosis. All right. All right, one more question.
Well, I found that our food that we eat is so much the medicine. So like when we're talking anti-inflammatory stuff, I've been able to control a lot of pain just by implementing turmeric and ginger.
Yeah.
Just a little bit of it. But I'm also real sensitive where I've never taken medication.
Right.
Hardly at all. And so it makes me either sick to my stomach or gets some headache. So my choice is try to find it.
I'm glad. I think this is a great place to end because I am currently reading. Do you know the book Fiber Fueled? I'm sure that's one of my favorite nutrition books, lifestyle medicine and nutrition books. Dr. Will Bolsowitz is the author. He's a gastroenterologist. And he came out with another book this year called Plant Powered Plus. And I'm in the middle of reading it right now. And it's talking about this epidemic of inflammatory diseases, including autoimmune diseases that we have that have just skyrocketed in recent decades. And a lot of it is probably driven by the foods we're eating. They're very inflammatory foods. And so this book is directly addressing how to proceed with an anti-inflammatory diet. And if you could guess which type of nutrient can be one of the most potent anti-inflammatory nutrients, what would you guess? It's kind of read my mind. So he's a gastroenterologist and his first book is called Fiber Fueled. Yeah. So he'll talk about fiber ad nauseum in this book, but he really gets into like why this is important and how it helps support our beneficial microorganisms that live inside us. So that's, if anyone is struggling with inflammatory problems, I would get this book. It's really, really good, but I'm not finished with it, but Dr. Will Bolsowitz, some of his other books are probably out there, so you can get his name. Please don't ask me to spell it. All right, everyone. Thanks for coming.
And come back next week's Magic of Fiber with Charlie. So come back.
Yeah, I tried to monitor.